Minnesota Governor Tim Walz has ordered Minnesotans to stay home starting March 27th at noon through April 10th and limit going out to only essential needs. All Minnesotans need to follow this order. This is from the Minnesota Department of Health. Why? It will prevent more people from getting sick and slow the spread of COVID-19.
By staying home, we're going to limit the spread of this. We're going to buy that time. Um, we'll build out hospital capacity. You see it up here. We're going to increase testing simultaneously, and that will obviously be more important on the back end. And we're going to get those ICU units up. We know what it takes now. Our partners are there. We're working, and I just got off the phone with the 50 governors. Governors are building consortiums. I spent considerable time this morning with Governor Burgum of North Dakota, understanding that what happens when Wisconsin has one order, Minnesota has another order, and North Dakota has another order. Governors understand the importance of this. I get it as people travel back and forth that you can have local reinfection. We're seeing that in Asia. That's why we need to prepare for, once we get a handle on this, once we go through the first burn of COVID-19, that now the lessons learned allow us to handle it on the front ends. And governors are thinking about that, of how we could work together. As new data comes in, we will update this. And I can tell you, as I looked at those models, and you look at 74,000 of our neighbors, that is an unacceptable number. We can't allow that to happen. There are really two things at this point that we can add into the model. And when you put numbers into it, it changes the outputs. One of those is the R naught, which is the measure of how many people infect other people and how that makes that spread. You can change that number by limiting social interaction. And the other number that makes a difference in who lives and who doesn't is by changing the ICU and the healthcare capacity and healthcare provider safety and security. And we're going to take a balanced approach of changing both of those, which still will allow us to function and using the safety net in the short run that the federal government's giving. Just some of the things that we're hearing, and we'll get that information out there. They're extending unemployment insurance, I believe, for 13 weeks, with the federal government paying for that. That now allows us to keep our system in place for up to 39 weeks, helping on that. They're also taking into those of you out there listening who are independent contractors who might rent a barber chair or salon chair to get you into the system to help you and those independent business owners. We need to make sure that that back end is there, because this day will come when we're done with this. It will come when we will stand back up. We need to make sure that all the hard work that you've put in, the sacrifice you put in, allows you to start back up again and to benefit from that. So it's an unprecedented challenge for us, but it's one that I truly believe, and I think I told you earlier that data showed that by cell phone and movement, Minnesotans have risen to the occasion. We've slowed it. But again, make no mistake, slowing it's not going to stop it. It's not going to change the reality. This is a human issue with mathematics that are driving it. If we are smart, and we believe Minnesota has done this, and talking with the incredible medical device companies, the medical institutions that are here, the healthcare providers, and a very strong safety net of our nonprofits and foundations, Minnesota is as well prepared as any state to handle this. The collaboration and cooperation that the legislature has provided has given me the resources to be able to move quickly and swiftly. And as we've said every time, to move with data and to move with an outcome in mind, not to be moved by fear, and not to be moved because something seems simple, but moved with what will actually make a difference. So Minnesotans, we're in this together. I'm asking you to buckle it up for a few more weeks here. I'm asking our manufacturers to step it up and provide for the ICU units. We're going to draw upon all of the resources that we have and make sure we get through this together. So I will be addressing daily, just like normal, with our healthcare folks, our commissioner of DEED, Joe Kelly over at Emergency Management. And so today even we'll follow this up with a lot of the questions that you have. What I would ask all of you is to follow the media. Don't trade in theory or innuendo. Try and get the best facts possible. If something is not working for you, try and access sites where we can get it. Tell us what we can do better for you, and believe in your neighbor. And I want to just say, I saw the wonderful story when I opened my paper of neighborhoods that are getting out, social distancing, and doing physical training, PT, together in the mornings. That's the Minnesota spirit. We'll get through this, and more information will follow up. Thank you, Minnesota.